33 patients of the nursing home died from corona, Ministry of Health explained. About 150 of the patients of the geriatric institution in Haifa have been infected with the virus since the outbreak of the plague. Within 4 months, 15 of them died in a nursing home and another 18 in hospitals in the city. Management, our average age is 90. Every loss hurts our hearts, her brother Rabbi Hadar Gill-Ad posted 22:15. The 30th of September 2020, Margua nursing home in Haifa photo Gilna Hush, and in the Margua nursing home in the Kiryat Eliezer neighborhood of Haifa. 33 patients have died in the last 4 months from complications of corona disease. 15 of them died at the geriatric institution itself and the other 18 after being evacuated to hospitals in the city. This is 25% of all corona patients among the residents of the nursing home. The Ministry of Health said in reference to the data that the mortality rate in the nursing home is within the reasonable range, in view of the background diseases from which the elderly suffered. The nursing home is one of the largest in Haifa and has 400 licensed beds. The first verified patient at the site was discovered at the end of June. And since then close to 150 of the institution's patients have fallen ill. Today, there are about 70 verified patients and close to 50 others have recovered. About 160 patients are still in isolation. At the same time, 12 of the staff members are also ill in corona and the other 20 are in isolation. Patients who suffered from a decrease in stasis blood oxygen level and did not respond to antipyretic drugs were transferred to hospitals. The nursing home said today that they do not have the data on the exact number of people who died from the complications of the disease and how many of them suffered from coronary heart disease. The Ministry of Health has confirmed the information received by Ynet. The ministry said that corona patients in critical condition are referred to general hospitals and patients in moderate to mild condition are referred to designated wards or to their homes. 33 deaths make up 25% of all patients, and that is reasonable given the background illnesses they suffered from, the health ministry said. The Ministry of Health also said that in the case of Mרגוע Hospital in Haifa, it was decided in consultation with officials including the geriatrics department in the Haifa district in the Meganavet headquarters, to adopt an approach that allows them to be left in their homes for recovery. Patients whose condition was defined as serious were transferred to outpatient care for further treatment. Fighting fiercely, the nursing center said that they are fighting fiercely against the spread of the coronavirus. It is worth noting that the Ministry of Health has appealed to Margua's management to open corona wards at the institution itself. After examining the quality of care and the level of space adapted for sick residents, 160 residents who are currently in isolation. In order to maintain their safety from the virus, the residents are monitored 24 hours a day, 7 days a week, and receive the best care in full coordination of the Ministry of Health. Despite the great difficulty, the management and staff are at the forefront and do everything possible to make it easier for all tenants to cope with this difficult period. Unfortunately, the average age of the tenants is 90. The older tenants have faced a wide range of chronic diseases, have not had sturgeon and have not responded. Fever. And they were evacuated to Rambam and Bnei Zion hospitals and did not survive. Some even showed symptoms of the virus and some died of other causes. Every loss hurts our hearts and we share from the bottom of our hearts the grief of the families. At the same time, the Elderly Families in Nursing Homes Association noted that mortality in nursing homes has reached an unprecedented high. The number of outbreaks is rising and uncontrollable. There are more ongoing outbreaks that jump from 1 or 2 to dozens within a few weeks. Megan Mothers and Mothers policy, the lack of data transparency creates an imaginary silence that fatally harms the elderly.